Good morning. It's Friday, June 21st. I'm Shardae White, and this is Wake Up with KERA News. Let's get into what you need to know to start your weekend off right. No surprise to anyone, I'm sure, that temperatures are steadily climbing. We'll see mostly sunny days this weekend with highs in the upper 90s. As temperatures rise, keep an eye out for cooling centers opening up around DFW. These are typically public buildings like libraries or recreation centers, but can also include some private buildings like local nonprofits. You can find a list of those spaces at keranews.org. Now, let's get into today's news. The owner of several adult care homes in Tarrant County has been charged with murder. KERA's Becca Moore reports on the investigation into Regla Su Bakur.
Arlington police say Bakur was being investigated for the alleged abuse and neglect of several people in the care of her in-home health company, Love and Caring for People, LLC. She oversaw at least 5 properties in Arlington, Mansfield, and Grand Prairie. Bakur was arrested in February for allegedly abandoning and endangering one of her clients in imminent danger of bodily injury. Authorities added a murder charge Thursday after the Tarrant County Medical Examiner's Office ruled the death of another client a homicide. The medical examiner said Stephen Pancran's death was caused by mixed drug toxicity. An investigation is ongoing. For KERA News, I'm Becca Moore.
Some residents living in West Dallas could be exposed to higher levels of harmful air pollutants. That's according to a new health study. The study includes 6 months' worth of data from an air monitor placed in the community. Natalie Johnson is one of the researchers. She said the data shows some pollution exceeded federal standards.
It was over 35 times in a 6-month period that the average PM 2.5 daily concentration exceeded the EPA standard.
Residents hope the new data will help in their goal to remove heavy industry from their neighborhoods. The Texas Medical Board is meeting later today to consider rules to guide doctors on the exceptions in the state's abortion ban. Texas Public Radio's David Martin Davies reports the rules could clarify when doctors can legally perform emergency abortions, but confusion and fear over prosecution persists.
In Texas, if a doctor performs an abortion, they face life in prison and the loss of their medical license. There are exceptions to save the life and health of the mother, but confusion about that, set against those harsh penalties, has meant those exceptions really don't work. That's what Amanda Zawarski told the Texas Medical Board last month.
I nearly died as a result of being denied basic health care that I needed while I was pregnant with my desperately wanted baby.
Zawarski testified during a 5-hour public hearing over the Texas Medical Board's proposed rules that could clear up confusion among doctors about how to interpret the abortion law.
When I received the crushing news that my husband and Josh and I were going to lose our baby girl at 18 weeks, at that point my doctor should have been able to induce labor so that I could deliver our daughter and begin healing, both physically and emotionally. But with the way the law in Texas is currently written, an induction would have been considered an illegal abortion as long as the baby's heart was still beating. So I had to wait until I was in septic shock, literally on death's door, before my healthcare team could provide the care that I deserved and needed.
Zawarski said her medical emergency could have been avoided, and she only survived because of the eventual quick action of the medical staff. But had the proposed rules been in place at that time, she might not have made it.
The regulations you're proposing clarify nothing and only further complicate patients' ability to access health care.
Zawarski was the lead plaintiff in a lawsuit challenging Texas's restrictive abortion laws. Late last month, the Republican-controlled Texas Supreme Court unanimously rejected the challenge, ruling that the medical exceptions in the law were broad enough. However, the court called on the Texas Medical Board to issue guidance that would help physicians to understand when an abortion can be administered without breaking the law. But during the public hearing, there were many complaints.
I've reviewed the regulation, and in my professional opinion, y'all, they are not workable.
Dr. Austin Denard is a Dallas-based OBGYN who had to leave Texas to terminate her pregnancy because of a fatal fetal anomaly. She testified the proposed documentation requirements would make her job nearly impossible.
These proposed rules require me to consider many burdensome and in many cases impossible alternatives to abortion. all while leaving my patient's life at risk.
Dr. Todd Ivey, a Houston-based OBGYN who also testified last month, said he hopes the Texas Medical Board was listening.
This proposed rule change doesn't really clarify much for us.
Ivey said the medical board wants to hold doctors to the standard of reasonable medical judgment, but what that isn't clear.
It should not be held to a standard of medical certainty because it can't be. Providers may actually not agree on a single plan of action. It should not be limited to considering only adverse events that will happen without an action. It shouldn't require waiting until a mother's in imminent danger of death or impairment.
B. Morgan is executive director of Texas Impact, a religious grassroots network. She's calling on the medical board to give physicians the tools that they need to make the best recommendations to their patients, but she points out
they can't change the law, and the law is what creates this incredibly narrow exception.
Any rules that the Texas Medical Board does eventually put forth could still face challenges. The ultimate test is, will Texas doctors get the assurances that they can do their jobs and save lives by performing medically necessary abortion without the fear of being arrested?
That was TPR's David Martin Davies. In sports, the 2024 Copa America started yesterday. The U.S. plays its first game against Bolivia on Sunday at AT&T Stadium. And the Texas A&M Aggies will kick off the College World Series Finals. That's baseball, if you, like me, were not familiar, against the University of Tennessee Volunteers. They play Game 1 of the championship series tomorrow. California's Occupational Health and Safety Board has put new rules in place to help protect indoor workers from extreme heat. Depending on the temperature, rules range from providing a cool place to take breaks to shifting work schedules entirely. OSHA is working on nationwide heat rules, but the process to approving them could take years. Celebrate the summer solstice with Make Music Day today at the Frisco Discovery Center. For more information and things to do around the Metroplex, visit kera.org/calendar. Thanks for listening to Wake Up with KERA News. Subscribe to the newsletter at keranews.org/wakeup and connect with us on Instagram and Threads at KERATX. I'm Shardae White, wishing you a great weekend. Keep cool, and we'll see you right back here on Monday morning.